Hi, Jody Killaley for Journal 2. Discuss patient interaction, which there is transference, countertransference, prejudice, bias, judgments that you may be making about the patient or that they're verbalizing about you. Have you encountered this before? Where did it originate? Would it be appropriate for you to continue to provide care for this patient? If so, how would you prevent these issues from affecting the care you were able to provide the patient? I had a patient come in who was around 18 years old. She was no longer pregnant, and she wanted to talk about being on something for depression, but this was, I think, her third abortion. So I think I had to really hold back with the interaction with her and not have prejudice or bias or judgment. It was very hard for me not to judge at 18. Where I work is very impoverished. I drive an hour to work. I really love my job. So, not that I don't like my job, because I love my job. I live in Monument, Colorado, but I work in Pueblo, Colorado. And it has a lot of crime, a lot of teen pregnancy, a lot of violence. It's probably I think it was voted the 10 most dangerous place to live in Colorado, in all of the United States, not Colorado, the United States. So I think it goes on from generation to generation to generation. I am from a small town as well. I am not very far from Colorado, from Pueblo, but I wasn't raised like that. So I think that my prejudice and bias really did interfere with the relationship that I had with this patient. I tried my hardest with my facial expressions not to have a prejudice, a judgment, or a bias. And maybe there was a countertransference of my judgment, and I really tried hard not to have it. But I did have to leave the room for just a second. I said, I'll be right back, and kind of pull myself together, because it was almost like just so okay with the patient and so okay with the patient's mom that this was just happening. And I did talk to her about her behavior, and I asked her if it stemmed from somewhere, and maybe if she wanted me to get her to a therapist. And it actually did work out. I think what it originated from, and of course it's happened before. I had a patient in the ER when I was an RN who had an abortion, and she was with a man who was married, and she came in, she was bleeding from the abortion. I'm actually pro-choice. I'm pretty open-minded about it. I think women should have a choice. It's hard when a woman does it as a form of birth control. I feel like there should just be other forms, like especially even for my Medicaid patients. There's so many options. There's so many things that I can do. I can give an IUD. I can, do anything but continue to keep having pregnancies that are terminated, or, just doing that to your body, or just not helping yourself. I guess was my transference, was why aren't you helping yourself? I guess that's where I'm like, what is wrong with you? Like, what are you doing? And I did end up putting her on an antidepressant. She did come back a few weeks later, and she's much better now. She feels better. I did talk to her, though. I did ask her, what is there something stemming from your childhood that maybe you feel like you're not getting, or maybe you didn't get as a child from your parents, that you're trying to attach yourself to maybe feel loved in some way. She did talk to me, and she was very open about finally getting a therapist, and maybe going through her childhood, maybe going through the trauma of having an abortion, because after 3 abortions at 18, there has to be a lot of trauma from that. And yeah, I do still provide care for her. At first, I thought it would affect the care, and I almost had a hard time caring for the patient at first, but then I kind of developed some type of empathy because she did say that she had been sexually assaulted as a child, sexually abused by an uncle, and I think it's just been a long pattern for her. And when you don't know any different, I guess you kind of can't live your life any other way. So once I finally found the empathy to treat her, I did treat her with some antidepressants. She does feel better. She came back. It was very hard at first. I'm not going to say that it wasn't hard. I was like, what are you doing with your life? I wanted to be like, she's not my child, but I still wanted to be upset, and I wanted to transfer that to her, which is I can't do that. But I didn't. I think I handled it okay. Do I think I handled it perfectly? Probably not, because my facial expressions usually give myself away. But I'm working on it, and I think I in the end did okay, because she's willing to go to therapy, she's willing to be on medications, and she'll be back in a couple weeks. Thanks.